you for joining us on Give It a Name with Jennylyn, the show that you can feel free to name by going to my website, giveitanametv.com, and just let me know what you think my show should be called. Today, I'm going to be speaking to Ted, who is an acupuncturist and an herbalist, and Jennifer, who is our naturopath. And so we're going to find out today the differences between some of the drugs we take and the natural replacements that we can use and how they can benefit us. So Ted, why don't I start with you?
Okay.
You want to tell us a little bit about what you do and,
Sure.
and what acupuncture is?
Sure. So practicing acupuncture and herbal medicine both. Acupuncture is a really old system. Some people say 5,000 years old, but certainly 2,000 years old. And it's a system by which we can heal the body by improving circulation, improving blood flow, and overall just supporting normal function of the organs. And the way we do that is by using very fine needles inserted into acupuncture points, of which there are about 300 on the body. And so depending on what condition presents, the acupuncturist might choose somewhere between 10 and 12 needles to address a certain condition.
Great. Well, I'll come back to you. And right now I'm going to let Jennifer tell us a little bit about naturopathy. Mm-hmm. And then I'll share a story with you about acupuncture.
Okay.
So Jennifer, why don't you go ahead and tell us?
So naturopathy is also been around, long before we had conventional medicine. It can encompass the use of nutrition, mm-hmm. lifestyle changes, sleep, movement, fresh air, fresh water, maybe homeopathy, also the use of some herbs. Really working with people to help to educate them when they are interested in knowing what their alternatives might be or when they really want to take control of their health.
Brilliant. So a few years ago, I was having a lot of problems with my stomach, and I had been put on so many different treatments with my medical doctor, and nothing seemed to help. And a friend I worked with suggested going to see an acupuncturist. And at first I thought, this is really crazy. How is a whole bunch of needles all over me going to fix this? And I thought, well, sometimes if you don't try, you don't know. So I went, and I have to say that I was amazed. And after that, I was a convert. I went to see a Chinese medicine doctor who tried acupuncture in different parts of my body and put me on some medicine, a course of medicine, which I couldn't tell you what it is. Mm-hmm. But I really felt better. And since then, haven't really had that problem. So I wanted to ask you, how do you know when someone comes into you, what parts of their body you have to treat with the acupuncture?
Well, obviously it depends on what the chief complaint is, what that person is, what their issue is. But we use in Chinese medicine a number of diagnostic tools. One is looking at the tongue. I don't know if that happened with you.
Yes.
The other is pulse diagnosis, where we feel on the radial artery on the wrist.
Right.
And there's actually several different positions, and each position relates to an internal organ. So by feeling the wrist and looking at the tongue, we can determine what's happening with that person. And then we also use some more modern diagnostic tools like blood chemistry and other testing to figure out what's actually happening from a diagnostic standpoint with that person. And then we develop a protocol. So the short answer is it depends on what's happening, but we do use a number of diagnostic tools to really get to the cause of the problem, not just the symptom.
So do you send them for a blood test?
You can if that's required, or you can refer them back to their medical doctor. In my practice, that's what I often try and get the patients to continue to work with their physician and just work in a coordinated fashion.
Oh, that's great. And the doctors are willing to do this?
Yeah, most are nowadays. It's really changing.
Okay. And Jennifer, what's the difference between what you offer and what we call Western medicine?
Well, it really depends on what the client wants to work on. I've had people call me and say that they've been diagnosed with wheat intolerance, but they're not sure where to start. So we'll sit down and we'll figure out menus, and we'll also look at ways that other issues that are going on that might be tied to the wheat intolerance. Or maybe there are some other allergies that didn't necessarily test positive through the doctor's office, but they say, you know, sometimes when I drink milk or I have dairy, I get really this uncomfortable feeling, but the blood test came out negative. So we'll look at different ways to do that. For people with adult onset asthma, for instance, looking at some of the lifestyle choices they might make that, or diet choices they might make that contribute to that, some of that excess mucus and swelling. Looking at stress relief, is the asthma induced by stress? And then looking at different herbs that are often helpful with asthma that, you know, and so I would say to the client, this herb has been used a long time for what's called bronchial constriction.
Right.
So to open up the bronchioles. So then they can try the tincture if they want, and they can work with their doctor to wean down off of their asthma meds, which they don't need as much anymore because they're making other positive changes in their life.
So you do work with the doctors,
Try.
not independent?
Yes, yes.
Okay.
I mean, I do have clients who have switched doctors because their doctor was not open to the changes that the person was making, or put the person down for the changes. That'll never work. And the person will switch doctors because that doesn't help anybody. We all want the patient to heal and to move forward. So I almost sometimes act as a role of a coach. Okay, these are the questions you can ask your doctor. And then they can go and present those questions to their physician.
Okay.
And I would just add to that, I think you always have to figure out where the person is once they come in. And I think a lot of times an intervention or a tool can be nutrition, it can be herbal medicine, it can be dietary changes. And you have to figure out where that individual is. They may want to stay on several medications, and eventually you can transition them off of medications onto more natural medicines like herbs, but safely and carefully. So it really depends on where the person is.
Okay, because you hear so often you have to be careful with taking some of these drugs because of you know, the side effects that they may cause if you're taking other drugs.
And I think that's a valid concern. I think that there are drug-drug interactions
Right.
which medical doctors and pharmacists understand pretty well. There is this very large and growing field of herb-drug interactions, because a lot of people are either doing self-treatment by getting something at the health food store, or sometimes getting prescriptions from multiple practitioners. And so I think it's really critical to understand what medications you know, if you're taking a medication, make sure that either your herbalist or your MD understands any potential risks there, because herbs can potentiate a certain medication to make it more sensitive, or it can get in the way or block the function of a certain medication, which can also be a problem.
I think Ted brings up a good point that when someone is seeking out alternative or complementary therapies, that it's really important to find a practitioner to work with. This is, you don't want to be experimenting with these things on your own. I mean, it's one thing to, you know, to cut out milk for a month and see how you feel on your own. It's another to start working with herbs, and some of the supplement use, with, especially if you're on pharmaceutical medications,
Right.
or if you have an underlying chronic issue such as diabetes, heart failure, you know, some of these more serious things that we're seeing in our society today. It's very important to find a practitioner with whom you can work to integrate these therapies into your healing.
I think part of the problem is, especially in today's medicine, doctors have such limited time to spend with you, and people just to see the doctor, it costs so much. Some people they're told, go buy St. John's wort, it's good for this or it's good for that. And so they just go to the pharmacy, and because you don't need a prescription for it, you figure it can't really hurt you. So then could you explain to us what exactly naturopathy is?
Gosh, you know, it is hard to sort of squeeze it into a box. I mean, I think the whole thing about the whole point of alternative and complementary medicine is to think outside the box.
Okay.
You're not trying, I think the point with conventional medicine is you're trying to suppress a symptom. You have high blood pressure, you take a medication, your blood pressure goes down. But it's like you have a balloon and you squeeze the balloon and it bulges out somewhere else. You still have all that air inside the balloon, it's going to move around. So the same thing with the body. When the body expresses a pathology, when it expresses high blood pressure, when it expresses heartburn, what is the body trying to tell us? Is there an emotional component? Is there a spiritual component? Has someone just died? Is there a physical component? Is there a nutrition deficiency? So what naturopathy does is it looks at all these components besides the cellular structure of the human being, the pathophysiology, the disease state, and it looks to see what are the underlying issues. And again, like what Ted was saying, sometimes you have to start really small. Sometimes that means someone making themselves a salad on a daily basis because they're so used to eating out all the time or eating processed foods that they're not sure it's a struggle for them to cook a fresh vegetable every day. And that's their first step, and that's a great step. And some people are ready to throw out everything that's in their pantry and start cooking scratch 3 meals a day, and go right to it. And that's great too. But you really have to incorporate where people are at, as Ted was saying. And unfortunately, the way conventional medicine is currently set up, when you only have 5 minutes with your physician, they don't have time to look at you as an individual. And that's the strength of alternative and complementary medicine, is that you look at the individual.
So you guys spend time focusing on the patient's history.
As well, yeah. I think you can't miss. You don't want to miss the forest for the trees. I mean, you have to look at the person's relationships, their diet, lifestyle, and any pre-existing conditions or familiar or genetic factors that may cause them to have a certain condition.
Okay.
And you really have to take time to look at to talk with the person to figure out what they need. The one thing I would just modify her statement with was that my experience, certainly being in this area in Mountain View, was that people are always on drive, and there's never an excuse or there's no allowance to actually stop, take the foot off the accelerator for a couple minutes, because everyone else around them is always pushing full bore. Some people have great constitutions and they can do that, but most people don't. People aren't getting enough rest, or they're too stressed to actually ever let the body to recover. And sometimes people need permission to back off a little bit.
Right, I agree with you, because I think also we are raised with the form of medicine the Western medicine, I don't know if that's a correct term, that's what I call it, and so that's what we're comfortable with. So when you try to introduce anything that's new, people are not comfortable because they're not sure if it's safe. And I remembered another story I'm going to share quickly because it endorses what you're both saying. I had a ganglion cyst on my wrist, and it was very ugly. And so that bothered me, and it started to become painful. And it got in the way of my watch and stuff like that. So I went to see a doctor who drained it surgically and injected with some steroids, and then put a coin on it, strapped it really tight, told me to keep it like that for 3 or 4 days and then it would be fine, which it was for a very brief period, and then it returned, and it was even bigger than it was before. Someone directed me to a Chinese medicine doctor, and the first thing he told me, he says, "Jenny, your spine is like the fuse box of your body. If one of your fuses has blown, things aren't going to work like they should. Your circulation isn't working like it should." So he started off by realigning my spine, which was out of whack. And then he had me detox my body, and he just started with the acupuncture. And I can't tell you how it worked, but it did, and here, it's gone. It's never been back, and this happened 3 years ago. And so I'm a believer, because I have evidenced it in 2 different situations, that it does work. So my next question is, how does what you do tie into what she's doing? How does acupuncture and the naturopathy go together?
Do you want to take it first? Or? Okay. Well, certainly they're complementary. We're both trying to look at all the systems. Chinese medicine is a pretty well-established system that goes back, as I say, many years.
Right.
That has its own set of tools, and it looks at the organ system slightly different than Western medicine. But in essence, we're trying to either restore the function of an organ that's not working very well, or calm down a system that may be inflamed.
Okay.
That's certainly looking at internal medicine with acupuncture. The other thing we can do, looking at the musculoskeletal system, is improve circulation.
Right.
And really what we're doing is taking advantage of the underlying nervous and blood vessels, those underlying structures, to really improve the body and get it working again. So I would say, and you might want to talk about how that ties in with what you do.
Yeah, definitely. I serve much more as an educator to my clients. So if someone comes to me and says, I have this knee issue and it acts up every time I run, but I'm not sure what kind of exercise I could do or movement I could do for it, or gosh, I noticed there's a correlation when I eat sugar that my arthritis acts up. So we can look at that, and at the same time, since I'm not a hands-on therapist, I can send my clients to someone like Ted, who can do the actual acupuncture and treat those, or if I feel that there's some sort of blockage somewhere, or I've been working with someone for a few months and things just aren't moving, then I can send them to someone like Ted, who can get things moving again.
So then, how do people even find out? I mean, Jennifer, you know how we met.
Yes.
I interviewed you on a previous show, and I thought, gosh, this is fascinating. And so I wanted you to come here and share this with people watching my show so that more and more people can become educated. But how do you guys normally, you're also a nurse, right?
Nursing student, yes.
So you have your feet in both arenas, which is brilliant, because you can incorporate all that you're learning from both sides for the benefit of the patient, which it should be about. So what frustrations are you experiencing as a result of trying to merge the two, if any?
I was very happy when I got into nursing, into nursing school, and started learning about the ideological theories of nursing, how holistic it is.
Right.
It's really about the benefit of the patient and helping the patient to heal. On the downside of that, there are, we all come with our own experiences and our own philosophies.
Right.
It bothers me when people say, well, there's no proof that alternative medicine works.
I've heard that.
But the reality is that just because there's not an official mechanism of action where a drug is blocking the adrenergic receptors and therefore it's stopping high blood pressure, just because that doesn't exist, or just because there wasn't a random placebo double-blind study, that this doesn't work, because there are millions of people walking around just in America who say that I've tried this and it works. And there has been study after, and what I just try to tell people is study after study after study is showing that people whose doctors, just from a traditional MD standpoint, people whose doctors know about complementary and alternative medicine, they have better outcomes and they cost the system less money. And they live longer. So there was a study in Denmark or Holland that just came out recently, studies here, one out of Seattle that just came out. So these are the things that, for some people it is about the bottom line, and that's a shame. But we can show them, here's the bottom line. And people who do alternative therapies get better faster, they have better outcomes. And that's really what it's all about.
So I think a lot of it has to do with our philosophies. Some people are so locked in to what they believe in, they're not willing to try anything outside of that because everything else scares them. And, we have to recognize and respect that. Yeah. But have you been able to get the people who you've treated to really share with share and encourage other people so that they too can come in? Because the bottom line is, if you have a problem.
Well, it's funny, because I don't treat people. Legally, I'm not allowed to treat people. I'm not a licensed practitioner.
Oh, no?
I educate people, and I empower people, and I give people the information they need to take the steps that they wish to take control of their health and to get better. So, and yes, people do. I've had people, one client, I only saw her once, and I thought, gosh, I wonder what happened. And she emailed me a year later to say how much better her daughter was doing. Her daughter's eczema had totally cleared up, how grateful she was that she had talked to me, and that, she was telling people about my services. So, you never know. You never know.
In my experience, I think that one of my favorite things to do is to get the person you described into my office who said, I don't want to be here, my doctor told me to come, or my wife made me be here, and I don't believe it works, and I'll do a little bit of education, but my job is not to convince them with my words, it's with the results.
Right.
And so I think that's one of the most gratifying things to do, is to help someone with a certain condition, and you can create no greater advocate for alternative medicine, or in my case acupuncture, when you really affect someone's life positively, as that practitioner did yours.
Oh, absolutely. I'm a convert.
Right.
So my next question, and I don't know which one of the two of you would like to answer this question, is since you don't treat, you just educate, what resources do you guys have for people after you've educated them in terms of where to direct them to find a treatment?
Well, yeah, I was going to say, well, for me, some people don't need to be treated. They just need to know that the resources are out there. Mm-hmm. And they need to know that by incorporating cod liver oil into their diet, you know, which my parents think they had these horror stories of this rancid, horrible stuff that they took as a kid. There's really good products out on the market now. The taste, it's flavored with mint or chocolate, whatever. You know, that just that little bit can make a huge difference with inflammation, with immunity, with seasonal affective disorder. They just need to know that, and then you know, they can take that from there. When I see people, I have a huge network of people that I work with, acupuncturists, osteopaths, MDs. So I can work with massage therapists, you know, people that I can refer out to. And it's like we're like a web that we can work together.
Right.
Well, you mentioned, sorry.
Oh, I would just echo that statement that Jennifer made. It was, I have a group of practitioners that over the years I've built that I find are relevant for certain conditions where I'll refer out. The most important thing is to know your own limitations, what you're good at treating, what you're not, and if there's something that you don't think you can help with, to know the person that can help.
Right, because it's one thing to tell people what can work, but it's another thing to tell them where they can find it. And so you mentioned eczema, and I've got quite a few friends with serious cases of eczema. In fact, my best girlfriend, she gets it in her ear, on her elbows, on her knees, very badly, and she's had it for many, many, many years. I think right now a medical doctor is injecting the actual spots with some kind of steroid.
Yes.
What would you recommend or suggest for someone who's having a chronic problem with eczema?
Well, what the steroid does is the steroid suppresses the immune system and says, don't react to this. Whatever you're reacting to, don't react to it. I would take a whole look at their history. Oftentimes, eczema is related to diet intolerances, such as a reaction to wheat or milk. Those are the two big ones, but there are other things out there. Sometimes, especially living here in the Bay Area, because our air quality sometimes suffers. You know, we have the Hansen cement plant, which emits so much mercury, and the Almaden mines, also mercury from there. I think there's definitely a correlation between, and there haven't been any studies, but this is my own gut feeling that there's a correlation between some of the heavy metals in the air and eczema.
Really?
Because you can see some of the kids with eczema, it flares up when the air quality is worse. And that's their way of instead of getting something like asthma, it shows up as eczema. So I can't say, well, this is what I would do, this is what I would suggest for this person, because that person is such an individual. But definitely look at food.
Okay.
Look at topical applications. Calendula ointment is great which you can pick up at any health food store. It's great for eczema to put on for if it's itching, if it's particularly uncomfortable for that scaling, and to help heal some of the scaling on the outside. But the skin is an organ of elimination, so the body's pushing something out, and so the question is to address what's going on inside.
And I would add to that, from a Chinese medicine standpoint, we look at the digestive system and also the lungs. Each of the organs has a external manifestation or other part of the body it's connected to. And so the lungs are connected to the skin.
So she was a smoker. Does that make...
yeah. Wow. So what you might look at is eczema just being an external expression of internal inflammation.
Well, she stopped the smoking, but she was a heavy smoker. I'm going to make sure she watches this show.
Okay. Yeah, there's a lot she can do. So, she can be helpful.
I'm going to make sure she sees and talks to you. She doesn't live here, by the way. She lives in New Jersey.
Well, we can refer her to somebody.
Okay, good job. This is exciting, seriously.
And I actually do phone consults, so...
Oh, brilliant. So then, would you tell me a story of somebody that came into you totally not believing, was forced, and you changed their world?
I think maybe that's all of my patients. I don't know, but not all of them. So one story I think about was a big guy. He's probably 6'4", and definitely kind of a type A personality, ex-football player, had like unremitting back pain. And he was literally on one of my offices upstairs, and so he had to walk up these stairs, which he was not happy about. And in his case, he just had really bad muscle spasms. And there's some really great acupuncture points that can release muscle spasms quickly. So within about 15 minutes, instead of being down, bent over, he was able to walk upright. Now, I didn't fix him in one treatment, but it was such an amazing change that he has been, he's told all his friends.
I hope you have a website and you have testimonials on there so people can read, because it always helps when they have other people to relate to who've achieved success, right?
Definitely.
And what I would add to your earlier question, you'd ask about how do people find people like us. Obviously, the best thing to do is for people to talk to a friend who's had a positive experience.
Okay.
The internet is extremely helpful now.
Okay,
Looking at other reviews, looking at websites, and to go with your own intuition. Figure out who you think you like, and find someone that's a good fit for you, someone you can trust.
Brilliant. So we kind of have we're running out of time, but Jennifer, you were sharing a story earlier with me in the green room.
Yes.
Do you want to share that with
sure,
our
This
guests?
is for myself, actually.
Okay.
Being fair-skinned, I'm always on the lookout, and having a family history of skin cancer, I'm always on the lookout for things that are unusual in my skin. So I had something that was a little unusual on my leg. So I went to see the dermatologist to get it checked out. So she did 3 cultures. She did a bacterial culture, fungal, and a neoplastic, so if it was cancer or not. And the cultures were $1,500, and then her visit was very expensive, plus the procedure itself. It ended up costing over $3,000 for the visit. She gave me came out as a fungal infection. She gave me a cream to put on it. Cream made it worse. I stopped eating sugar, and the lesion went away.
Sugar, that
Sugar,
creep.
Yeah.
We all love it.
The best,
right?
worst thing around.
Exactly.
That's right.
The best, worst thing. I like that.
Yes, definitely.
So we have a minute left. How about if you share something with our viewers that you think, if they have doubts, will change your minds, and it may be someone who needs you, so they can pick up the phone and go to see you? What would you want to tell them?
I think I would just say acupuncture and herbal medicine can be very helpful for a number of conditions. Sometimes it takes a little bit of courage to go out and try something new, but that if you just give it a try, I think that you'll probably be very pleasantly surprised with the results.
Okay, and you, Jen, real quick.
Oh gosh, yeah, I think that Ted really hit the nail on the head. You have to give it time, and to really have faith that these things are going to work. You're not going to take a pill that's going to magically take care of your symptoms in half an hour or 3 days. It's going to take time, but to really work with it, and it will pay off.
Well, thank you so much for joining us today on Give It a Name with Jennylyn. And as always, I hope that you will learn something from spending the time you are with us. And thank you very much.
Thank
You're
you.
welcome. Thank you.
Let's all get healthy.
All right.